So once you have your 18 inches of floss, you're going to wrap most of the floss up on one hand and keep the other hand with a little bit less floss. Then you're going to begin by starting on the very back of the most posterior tooth. Even though there's no tooth next to that tooth still has a sulcus. So we want to make sure that we're getting the floss into the sulcus and cleaning that debris out. Then we're going to go to the next set of teeth. On this area, the teeth are tight, so you want to make sure that you use a seesaw motion using your thumbs to seesaw between the contact until you feel the floss pop through. Once you feel that, you're going to wrap the floss in a C shape around the back tooth and slide the floss up and down a few times into the sulcus and out. Then you're going to curve the floss forward to the tooth in front and do the same thing, sliding the floss up and down 2 to 3 times before removing it from the contact. And you can use your thumb to pop the floss out of the contact. Then you wrap up the old floss and unwrap fresh floss from the other hand. So again, we're going to seesaw up. The seesaw motion is what protects our gums from feeling that floss snap up onto the gum tissue. So we seesaw in. Once it hits between the contact, you're going to wrap the floss to the back tooth, slide up and down into the sulcus and out 2 to 3 times, and then pull the floss forward and do the same thing on the next tooth. Okay, getting fresh floss, seesaw into the contact, C shape, and slide up and down. 1, 2, 3. Pull forward. 1, 2, 3. Using your thumb to pop the floss out. You're going to repeat this for every single tooth, every single space between your teeth. So, again, you want to make sure that you're really adapting the floss to the tooth using your index fingers or your thumbs, depending on which way you're going. Seesaw in, and then slide up and down, and then to the other side. Some of your teeth may not be as tight as other teeth, so you may not need to seesaw. Once you've gotten past the midline, you can rotate your hands so that you're not twisting your hands this way, right? So you're going to have your right hand on the outside, seesaw up, 1, 2, 3, 1, 2, 3, and using your thumb. And seesaw up, 1, 2, 3, 1, 2, 3. The goal is to get up between the teeth without injuring the papilla, which is that pointy little bit of tissue that comes down right between our teeth right here. So that's why we want to seesaw rather than just pushing right up, because if you pop or snap the floss up between the teeth, you're definitely going to injure the papilla, and it's going to make flossing a little bit uncomfortable. Let's see. Get some fresh floss here. Okay, 1, 2, 3. Seesaw, this one's a little bit tighter, and we're really curving into a C shape. Look how high I can get up into that sulcus. Okay, and then using your thumb to pop out, and again, the very back tooth is going to be flossed as well. And this, of course, doesn't require any seesaw because you don't need to get it through the contact. You're just gonna slide up, wrap it in a C shape, and sometimes it's just a matter of pushing it up into the sulcus and sliding down. Give yourself a break between the upper arch and the lower arch, and then you're going to move down so your fingers don't turn purple, and we're gonna start down on the lower left quadrant. So just as our order of our tooth numbers goes, we're gonna start number 1 or number 2, whatever's present in your mouth, all the way around to 16, and then dropping down to 17 and coming around all the way to 32. So again, we're gonna use a thumb or an index finger to access the very back of number 17, the distal. We're going to slide up and down. Then we're going to do seesaw to pop through that contact. C shape. Now on the lower teeth, you can really see the C-shape motion or the C-shape action that we're doing here. So you can see that floss is adapted completely around the curvature of the tooth and sliding up and down 3 times and then pulling forward to the next tooth and using your thumb to pop out. Seesaw down, C-shape back, 1, 2, 3, and pull forward, 1, 2, 3. So we're doing a sliding motion to get down, and then we're pulling the floss up and down against that surface of the tooth, and then up and down against the other tooth, remembering not to injure or damage that papilla, that pink tissue right between the teeth. You don't want your floss resting there. You don't want to drag your floss straight across the papilla. You want to mind the papilla. There you go. You want to mind the papilla. So you don't want to pull straight across because you're going to hurt your tissue. You want to come up and then go down. And then pop out. Okay, so again, this can be time consuming when you first start. The more you do it, the easier it gets. We want to make sure that we're disrupting that bacteria once every 24 hours with floss. Okay, so we want to floss at least once a day. If you're not a flosser normally, this is going to be a little bit painful in the beginning, but after about 2 weeks, your tissue should hopefully start to heal up a bit, and your bleeding will stop, ideally, and it will be comfortable. So flossing shouldn't hurt. All right, and again, changing the hand position as needed once you cross over that midline. Okay. And pop up, seesaw down, curve the floss around the tooth, and 1, 2, 3, then push back to the tooth behind. Seesaw down, 1, 2, 3, and then push back. You can floss any time of day. Something is better than nothing. So make sure you do it. It doesn't matter when you do it, just do it. And again, that last tooth, we're just gonna kind of push down into the sulcus on the back, wrap it into a C shape and just slide up. Okay, so now that you've flossed all of your teeth, you can dispose of your floss and rinse out with some water.